Confidence is such a big issue, and whenever it comes to anything embarrassing, people don't like to talk about it. With this procedure, how many procedures do you usually do? How much does it cost?
Well, for most men, you know, this is an issue that they don't like to talk about a lot. I focus a lot in alternative medicine, and a lot of the guys who come to see me are the guys who don't want to take medication, so they're always asking, what could I do next? And so that's where GainsWave came into play. Typically, we do 6 treatments on most guys presenting, and then we could always wait about a month and follow up with 6 more treatments. For 6 treatments, the general cost is about $3,000.
And let's talk about the idea of what's going on here.
Sure.
The goal.
Sure. So the idea of the machine itself gives out this low-intensity sound wave that actually stimulates a little micro trauma in the cavernosum itself, which stimulates more vasculature. Because in most guys, erectile dysfunction is lessening of the vasculature in the penis itself.
It's a blood flow problem, and so the idea, whether it's the medications or certainly a procedure like this, I'm curious because you're a urologist who we've talked about before.
I wrote the book.
Penis book.
I wrote the book.
Yeah. So for people who are looking for alternative treatments to medications, is something like this a good option?
With regards to the idea of shockwave therapy and improving the blood flow to the penis, there's some really excellent science out there that is demonstrating that shock waves of a particular nature really can stimulate stem cells in the penis and cause remodeling and take blood vessels that were getting kind of narrow and getting kind of stiff and rejuvenate them. But none of these devices that use these particular shock waves that have been shown scientifically to give these benefits are yet FDA approved in the United States. I don't think that there's any harm whatsoever to the treatment that you've received. The device you were treated with is safe. It uses air pressure to create a vibrating massage. And indeed, when you massage an area, blood flow will increase to it. At higher intensity, we use it to break up kidney stones.
Right. What are things that men in general can do to potentially, I don't want to call it treat themselves, but maybe prevent ED in the first place?
In my book, I have a 5-step plan for maximum penis health, and that's really about prevention and staying as healthy as you can. And those tips are: 1, diet. You want to eat vegetables, green leafy vegetables that give you that nitric oxide that pumps up your blood vessels. You want to exercise, because exercise improves your blood vessels as well. And again, the penis is all about blood flow. You want to avoid toxins. You want to avoid heavy alcohol and cigarette and drug abuse. You want to get a good night's sleep, believe it or not. Sleep promotes your testosterone, and it promotes the blood flow, and it decreases the anxiety and the adrenaline, which interferes with your erections. But probably the most surprising of all the tips, and even though I've joked about it, it's no joke, you want to cut out pornography. Amazingly, viewing pornography on a frequent and regular basis actually shrinks centers of your brain that are important for your sexual response, actually changes your brain on MRI studies, and it ruins your ability over time to have natural healthy erections, and it's ruining young people's natural healthy erections, even high school students. So if that is my one interesting takeaway, is cut the porn.
And before we go, Dr. Savage, I want to ask you, because you're using alternative techniques like this, the men that are coming to you, I'm curious what their average age range is.
Well, the average age range is anywhere from 30 up to 80. I was very impressed when I went to see this technology demonstrated the first time, because out of the 15 patients that I saw, this was not scripted, 12 of them reported great results. And I agree with Dr. Spitz. The risk ratio of this is very low. Out of the hundreds of patients we treated in our office, the only patients we really had complications from were with the numbing gel that we actually put on the penis. They had a reaction to it. Right. But when you survey these people as they leave the room, we're in the 70, 75%. But it's bringing in a holistic approach that is most important, because even if you can get the erections back, which you can, then it's making sure that you keep your body healthy enough to keep that going indefinitely for years down.
And I have to applaud, Jason, you for being open and honest about this. And the reason for that is because most people would look at you and you are fit as a fiddle. You know, you look like the poster child for a virulent man who would never have any issues. But the reality is you are the poster child in many ways for men who can suffer from erectile dysfunction, because it's so ubiquitous.
A real man.
I think that's an interesting point, because I do eat well. I live a holistic lifestyle. I exercise. I get good sleep. I do all these things. Yet at the age of 50, I still feel my body changing. Yeah. Did not like the way pharmaceuticals made me feel. I was looking for better performance. And I was able to do that through this process. I'm excited to be on the ground level of this.
Don't be afraid to address it with your doctor. 40% of men over the age of 40, that's a high percentage.
Oh, yeah.